you all to our annual meeting. As Jonathan said, a historic occasion, our first Zoom annual meeting. We're all learning as we go with Zoom, so hopefully things will go very swimmingly today. It's certainly a big help to us to stay connected and to continue our work. You'll have a few chances to participate today by putting your questions in the chat column. Everybody probably knows that down at the bottom of your screen there's something called chat that you can click on and then type in your question at the bottom of that section and hit enter, and it'll,
hey Chris, how you doing?
we can all see it.
Good.
Our program today, it includes our wonderful keynote speaker, Rep. Nika Elugardo. And after Nika speaks, we'll have time for chat questions. And then Brian will present our Mass Peace Action 2020 program. And again, you'll either have time for questions in chat or in individual chat rooms. That is, we might do breakout groups. I'm not sure what's been decided. Then we'll have a short business meeting led by Jonathan King, our other board co-chair. That will be board elections and quick votes on bylaws and an article of amendment. Please hang in there and stay with us for those votes if you're a member. We will do our best to respect your time and finish by 3:30. A big thanks to Cole and Brian and Jonathan for putting this meeting together. Cole, did you want to say something about poll questions?
I think we decided to hold the questions till Brian's segment.
Okay. Okay, great. So we'll let Brian explain that when we get there. Okay. We are really delighted that Nika Elugardo is our keynote speaker today. Rep. Elugardo was elected in 2018 to become the Mass State Rep for the 15th Suffolk-Norfolk District, and that includes the neighborhoods of Brookline, Jamaica Plain, Mission Hill, and Roslindale. This short introduction cannot cover all of Rep. Elugardo's work, but let me share a few things that jumped out to me. Rep. Elugardo came to Massachusetts to attend MIT after growing up in Ohio, where she attended both public and private schools. In Columbus, standing up to schoolyard bullies was the beginning of her lifelong commitment to fighting, then literally, for justice and against unfairness and abuse. Her first job out of MIT was with the National Consumer Law Center's Foreclosure Prevention Project. And that project had an 88% success rate at keeping people in their homes, which is something we're acutely aware of today. After law school, Nika became the founding director of MassSaves.org, a multi-sector collaborative that promotes economic justice in low-income communities statewide. Rep. Elugardo understands the intersecting nature of oppression. She has worked with faith leaders to fully accept and love our LGBTQ family. Helping diverse voices share leadership at the decision-making table is the core of her work. Rep. Elugardo has stated her goal in working in the Massachusetts legislature is to dismantle structural oppression and bigotry in our laws and in our legislative frameworks. Quote, I want oppression in our state and our communities to be a historic memory, not a contemporary reality. Rep. Elugardo.
Thanks. I have to admit, I don't like the bio reading parts.
Oh, you're modest.
It sounds different on paper than it feels in real life, but I'm sure everybody here knows about that. Thank you for having me, and it's a great encouragement to me that Mass Peace Action not only is alive and well, but has adopted me as um, one of the many elected officials that you care for and challenge and encourage and support. Because what you stand for, there was a fair amount of my life. I'm going to be 47 this summer. And I'd say for about half of my life as a child and a young adult, the ideas and the vision espoused by Mass Peace Action, when I would speak those things, I was alone. You know, in the 80s and the early 90s, I was generally laughed at as being too idealistic, people would say. And my retort was often, you know, reality isn't something that, I still say this sometimes, reality isn't something that just happens to us. We're responsible for helping to shape it. And if that's idealism, then I'm an idealist. And we have to think about what it looks like for our ideals to become reality. And sadly, as is the state of human nature, maybe, I don't really like that phrase, but I don't have a better one. Suffering, deep shared collective suffering, often puts us in a better position for the types of radical change that are required to come forward to a just society. But it's scary, it's terrifying, because it's a crossroads, it's a choice. And we know that we are always at that crossroads. But more people in the world, when the suffering creeps up into the middle class and beyond, more people begin to question the status quo and the ways that we think about things and our mental models, and to be ready for change, even if it requires enormous sacrifice on their part. And so I think I was asked to speak on, you know, what is the federal and the state government doing, and the pace of that change, and where are the gaps. But with this group, I want to preface all of that by saying, you know, I'm of more than one mind. The mind that I described to you from my childhood is deeply distressed. But there's also the reality of watching my colleagues really step up their game from the standpoint of justice. And that part of me is encouraged. It's encouraged even though we're far short, moving way too slow. But at the same time, some people that I have never really considered to try very hard at justice are working tirelessly night and day. Like, something's really grabbed them by the heart and by the collar. And people are very, very motivated. Not every single leader in the House of Representatives, which I can speak for most intimately of the government leadership, that and the Boston electeds of color, which also meet regularly. And we are, including our county leaders and our congressional leaders like Ayanna Pressley and Rachel Rollins. So we meet on Fridays during this crisis. Those are the groups I can speak most to, and most of the people have just really been an encouragement and an inspiration. Even people that I don't like, which is a very tiny number of people, but they exist. So the federal government, as you know, has this constraint that is our president. And it's not just him, it's also the administration that he has appointed, which is largely either, you know, I'm on the outside looking in like most of us, but it seems to be either incompetent or uncaring when it comes to justice. And those that might have talent and competence and care must be hidden by the general culture of his administration. And so even when they purportedly try to do good, it generally just reflects their values of the rich, and not even all of the rich, some subset of people that President Trump identifies with and sees as important in his life. And we all know that kind of thinking, let alone legislating, and policymaking is incredibly destructive, even when you're trying to help. The unintended negative consequences abound. And I don't need to go into details on that. Probably many of you know some of the details better than I do. But it is a real constraint, but it also presents a clear foil and opportunity for us in working with Congress that maybe hasn't been present outside of the COVID-19 crisis, in that Republicans are more likely to work with us on some things that would be considered progressive things. Now, the trick we have found in talking with Senator Kennedy and Congresswoman Presley is that's who reaches out to me about these things, is that even when relief is promised to, let's say, poor people, small businesses, mom and pops, the most vulnerable, gig economy workers, people receiving SNAP benefits, it is consistently implemented in a way that siphons off most of the value of whatever package we're talking about for the rich. And it does that structurally by making things easy. Well, they make things accessible for themselves, which is making it accessible for the rich. And people that speak different languages, people that don't have a social security number, which is lots of tax-paying people even, so they've invested money in the economy and cannot get it back out at this time, are completely left out. So that's many of our, or all of our immigrants without documentation. Many of our mixed status families are not eligible for much of the relief that's been provided. And so even when we look at the businesses, the business packages, large and savvy businesses are taking out all the money. It's run out. For example, the program that's called PPP, Paycheck Protection Program, was established to reimburse essentially companies that keep paying their workers. And that money has run out, and so far it looks as though largely the companies that need it the least were able to access it the easiest. And all of that was predictable, and there were congressional leaders, I know from Massachusetts and other places, fighting that and trying to mitigate the problem. But there's an active and aggressive effort to do that. There's an active and aggressive effort to make sure that no money is spent on reproductive rights that comes out of these packages that relate to healthcare. And I don't know why it blew my mind. I don't know. I was shocked that anybody could even be thinking about that at a time like this. But apparently that was a holdup for some of the earlier legislation that ended up passing in the form of the CARES Act. And even now, where the Republicans are agreeing to refund the PPP, the Democrats are unable to cut a deal with them that they find satisfactory. And so they want to add more things into it. So anyway, there's all that going on, and it leaves state legislators across the country with huge gaps in our information about what's going to be needed. How much of the benefit is going to come into our economy, how much of that is going to go towards our state budget, how much of it is going to go towards our residents. But one thing we can count on, and this is what many progressive advocates are saying, we know that poor people and immigrants and people who are incarcerated are going to get the raw end of the deal. So we can go ahead and legislate on that stuff, because the need, even if the federal government was deeply progressive and working really hard, there would be no way to meet all of the need without tremendous support from the state. So we have filed, I haven't counted in about a few days, and there's a few pieces of legislation being filed daily, but I think it's around 70 pieces of COVID-19 legislation. And I would say the vast majority of that is progressive. I have co-sponsored over 50 of those pieces of legislation. And the key areas are in cash assistance and unemployment insurance when it comes to individual assistance. So there are various cash assistance bills aimed at some of the populations that I mentioned. There are also bills related to the labor economy. So in addition to unemployment insurance expansion, there is a new bill that's come out to make sure that there's hazard pay for direct care workers, because we were able to pass a policy through the administration to increase the pay for state employees working, for example, with DDS and DYS, so direct care providers working with people who are institutionalized and disabled. But the already lower paid workers in the private sector, in the direct care economy is one where people are paid less, and very often immigrants and people of color, and always generally poor people. They're essential workers. They're continuing to work. They're not able to come home sometimes if they are caring for someone who's COVID-19 positive. It's very frightening work. Many of them are head of households, single parents. They're unable to go home to their children. And when they are, it's terrifying because they don't know whether or not they're bringing infection into the home, caring for adult parents, etc. I sit on the Children's, Families, and Persons with Disabilities Committee, and we had SEIU 888 come and present to us, and they had members from the different sectors within direct care come and represent their labor group. So DDS workers, DYS workers, DTA, which is overseeing nutrition and SNAP benefits. They've all had their workloads dramatically increased, whether it's because there's been a fourfold increase in people applying for food stamps, or whether it's because in group homes for that are DDS group homes, the folks are not able to understand social distancing, and the infection rates are higher, and the death rates are higher. And so despite that, their pay is very, very low. We can do something about that, and we need to. We also need a House member, I think it was Christine Barber, and then Senator Eldridge, just this last week filed legislation to make sure that every taxpayer, every immigrant taxpayer, regardless of whether or not they have a Social Security number, receives a stimulus check. So there are a lot of things that we can do. One of the big challenges, despite the fact that on the House side, I haven't heard such good news on the Senate side, but on the House side, the leadership seems transformed. I think a lot of the work that we've been doing together as a branch to shift more progressive all year, it hasn't all been external work. There's been, I know we're mass peace action, but we are in a war for justice. And it does have some very military-like components in the sense of, we need our ground teams, we need our air teams, we need our special operations, we need our people that are gathering intelligence for our peaceful revolution. And I think that the progressive wing in the Democratic Party has been very imperfectly, but much better at supporting each other and playing those different roles, having difficult, hard-hitting conversations behind closed doors with leadership, having caring, loving, relationship-building conversations with some of those same people, challenging people publicly, lifting people up when they do the right thing. And that work is really paying off. And it's the work of dozens and dozens of people, even people you wouldn't suspect or even think of as being progressive, but who care about justice in different ways. And so for the most part, the leadership is more open, more asking for our feedback, more accessible in my experience than ever. Does that mean that we're moving fast enough? No. The levels of competence for executing any sort of justice-oriented policy were never high, right? So what I feel that I can say is that most of our leaders, and I mean that in the broadest sense, we have committee chairs, as well as, we have a majority leader, we have assistant majority leader, the speaker, there's all these different kind of leaders. Most of them seem to me to be trying their level best and then some, working harder than I've ever seen most of them work, and smarter in many ways, and involving us in that work. Now there's skepticism about whether that's going to produce real legislation. So a major obstacle is that we have not figured out how to constitutionally bring 160 people together under the current public health crisis and vote. But counter to popular belief, people are working really hard on that. Now, I am not one of those people in those rooms, so I can only speculate as to whether if there were different people in the room, it would be happening faster. But I know they're working hard, and I've seen at least somewhere between 5 and 10 proposals that have been submitted to House Counsel, researched, and found wanting from a constitutional perspective of what's possible. And there's a slowness, which I agree with, this particular slowness, to bring all 160 of us together in the State House. It feels like a really bad idea right now. But I don't think on the House side people are hiding behind that. I think people are confused about how to proceed. And they're seeking the advice of people in and outside of the building on that, which is something I was very angry the first 2 weeks, I'll admit. I thought we were moving way too slow. I was too slow. I didn't realize we had a problem until the word pandemic was put out there on March 11th. Before that, I was complaining about how COVID-19 was dominating the news. So that's how much I knew. So I can't judge too much. But on March 11th, that word was said, there's a pandemic. And on March 12th, I closed my office. And that's when Mike Connolly and I and many others started calling on the governor to move more rapidly. And it took another week before us to do that. But as it turns out, we ended up being faster than a lot of states. So once again, Massachusetts is at the forefront of being the worst, meaning that our country as a whole is not anywhere close to where we need to be. So we can be proud that we were faster, but we should really learn from the fact that we weren't fast enough. Anyhow, since that time, they have brought in outside voices. They have been listening more. And there's a sort of desperation around that. But if we can't figure out a way to vote, we're only going to be able to pass the things that we can build unanimous consent for. So kudos to Mike Connolly, who has developed tremendous skill this year, throughout the year. This didn't just happen in the COVID crisis, at really bringing leadership along and supporting them in understanding how to craft progressive policy. And so he did that with the evictions and foreclosures moratorium that just passed. And trying to do that in a situation where you need unanimous consent is difficult, even though very often the speaker is looking for that anyway, before he'll let anything go to a vote. So it's a scary time legislatively, because as usual, the people that are suffering the most, they're not us. They're not the 200 legislators. So while we experience a type of urgency, I can't help but believe that if the legislature were composed of those immigrants and gig economy workers and elders with pre-existing conditions who had to stop working earlier because they were wise enough to understand that their health was in danger before the governor was, if that was who was doing the votes, I'm pretty sure we'd have a lot of legislation that had gone through already by now. But pointing that out to my colleagues isn't helpful at a time where everybody's being traumatized and everybody's working really hard on constituent services. Everybody's hearing from people who are unemployed and struggling, and everybody wants to make it better. And so that's kind of where we are, and where advocates can help is continuing, as advocates have been doing, and Progressive Mass has been incredible in this. You guys and others giving very concrete, specific, well-researched letters that say, like, these are the 3 bills that we want you to focus on this week. These are the 2 bills. These are the 5 bills that we need you to focus on this week. Those have been really helpful, and leadership has been receptive to those. They have acknowledged them. The Progressive Caucus is meeting daily at 10 a.m. And we are watching those things very carefully and bringing them before the leadership. My small group meeting with the leader, with the speaker, is next Tuesday. And we use those documents to help focus our conversation and to make sure that they're hearing from 60, 70 people the same message. So that's what your messaging enables us to do. And now there's a hunger for it, where you might have experienced, apart from a handful of us, resistance to having to listen to you before. Now there is a hunger for what needs to be done. What are people hearing? And they can clearly see that the messages you're putting forth are the same as what we're hearing from our constituents. Because it's not just Liz Miranda, who has 94.5% people of color in her district, that are getting the dozens of calls a day now. It's everybody. And so there's a resonance between what their constituents are saying to them and what progressive groups are putting on paper. The major obstacle now, and it's more real than it has ever been, a lot of times we use this in a false way, is where is the money going to come from? So we have a $3.5 billion rainy day fund. $3.5 billion represents about what we spend in 1 month of our budget.
Wow.
Something just happened. Oh, everybody can still hear me? Okay, that was my end. Anyway, it's fine. It's fixed. Predictions for shortfalls in revenue for the fiscal year coming are between $4 and $6 billion. I think it's going to be closer to $7 billion, based on some things that I've heard. And of the billions of dollars in aid coming in from the federal government, only a couple billion so far is going to go directly into our budget. I happen to be sitting in a place where I was taking some notes from our budget roundtable. Let me see if I have anything interesting here. Yeah, I guess I didn't put that right in this exact spot. Oh, there it is. Yeah. So yeah, less than a couple of billion will go actually into our state budget. Now there's another package that Congress is working on now, and it has municipal and state money in it, along with hopefully our progressive congressional leaders are working on making sure that there's infrastructure broadly defined to include what everyday people need, and not just sort of roads and banks and internet. And also that there's ongoing relief and recovery, not just a one-time stimulus check as came out in the last package, which was the third package that Congress put forward. And we are going to get a few $1 billion that goes to people and that goes to healthcare. But none of that is going to fill the gap in our budget, right? And so you all participate in lobby days, so you know there are a lot of things, even in our $43 billion budget that was fully funded, that didn't get funded, that we needed to be funded. Right? And I had some really exciting plans too, that I'd already even started to talk with the governor and some legislators about, with regards to youth development and supporting our elders. And all those new ideas are gone, right? And then filling in the gap of things that didn't have enough last year, that's gone. And now we have to look at, okay, so we have everything from libraries to healthcare to elder services to education that we had made commitments to. Where are the cuts going to be? And thank heavens for Mass Budget Policy Center. So they are meeting with the Progressive Caucus once a week and provided testimony at the budget roundtable before the chairs of Ways and Means, the House and Senate chairs, and the ANF head as well. And so they're helping to make sure that we understand where are pockets of untapped revenue that we've been talking about with regards to corporate taxation, with regards to more progressive restructuring of taxation, so that there is more money coming from those who are currently giving less. So fair share is just one of many things. The fair share amendment is one of many things that can be done. And so they are providing data to us to help us understand what sources of revenue are likely to still be available after we take into account which sectors have taken the biggest hit from the COVID crisis. So that's going to include many in the corporate sector. We want to make sure that we're protecting, especially our small businesses and our self-employed folks. And so we have a lot to figure out, even to know how far we have to extend the rainy day fund, over how many years. Do we need to extend the rainy day fund? There are those like myself and Sonia Chang Diaz who feel that we can take a couple $100 million out because we know we're going to need that, and we can direct that immediately towards the people who are most in need. But the majority of folks, including the majority of the Black and Latino caucus, feel that we need to have a better understanding of the bigger picture before we tap into the rainy day fund. And so we're trying to work with people to move quickly, and it's hard to know how to do that. Pressure from the outside helps, but it helps most when that pressure comes with an offer of help and an offer of understanding, and then here's the research, and here's how we think it can work, and not just that we think it should work in a certain way. And progressives, I think, modern progressives are getting better than ever at showing how we intend to pay for the needs of our constituents. And so continue to help us do that. And there's lots more that could be talked about, but I think it's time for me to stop and let people ask questions.
Yes, thank you so much, Representative Elugardo. Yeah, we know where the money is. That's one thing about mass peace action. And Jeff Klein, one of our board members, has a piece in the Dorchester Reporter this week about how this time of crisis is a time to be looking again at our national priorities. So your feedback about what's happening at the State House and this financial train wreck that is in front of us is very helpful. We have quite a few questions here, so let me give you some of them. The first one was, what is the progress of the Massachusetts Indigenous legislative agenda? Do you have any feedback on that?
Yeah, so we have, so there's a group of folks that have been meeting before, and I think we had one meeting or two after the COVID crisis hit. It includes advocates, Senator Roush, Representatives Lindsay and Gouveia, myself, and Senator Jason Lewis. And the Indigenous leaders and other advocates have proposed a package of bills that we're calling the agenda. But we also have added to that, because you're all familiar with what happened with the Wampanoag tribe and President Trump revoking their, I forget how to say it, but their reservation status. There's a legal term that I'm drawing a blank on. And we were able to get that legislation through in terms of having an extension. I can't remember off the top of my head for each bill exactly where it is, but in general, I will say all of the bills are with the Senate. And before COVID, we had planned an April 1st meeting between 4 or 5 of the Indigenous leaders and the 2 senators, Becca Roush and Jason Lewis, and the Senate president, to determine from her whether the components of the package would be put together as an agenda before the Senate or not. And that meeting was canceled because of things going on around COVID crisis. And so April 1st is the last that I have myself even tuned in. We had some very strong momentum right up until then, even post March 11th. And my sense, and I can't speak for the whole group because it's been a solid 2 weeks since we've met now, but my sense is that we still feel very confident that we're going to have some movement as soon as regular legislation comes back into the forefront of the business at the House. But it is somewhat dependent on Senator Spilka herself. And so the advocacy amongst members of the House and Senate, I think, have been really strong. And so now we need the leadership to bring it forward for a vote. And so that means making sure that when the time comes, Karen Spilka herself is hearing from her constituents about how important this is, but also from many committee chairs who should be hearing from their constituents. And that means really any committee, but particularly Judiciary and Rules, I believe, and Education are the, definitely Judiciary and Education. Sorry, I didn't have those. I was focused on COVID as I thought about this, so I didn't look up where those were.
No problem.
But one or two of our bills are in Education, and one or two, I think, are in Judiciary, or maybe municipalities. Anyway, we could know that. We could look that up easily and know it. But particularly the bills where it is, making sure that their constituents are hearing from them, the chairs and members of those. You just go in MA legislature, find the list, and have your folks across the state who are constituents call them and ask them to tell Senator Spilka that this is something that cannot fall through the cracks, particularly as the Indigenous community is particularly hard hit by COVID. And in Massachusetts, we have this added stress on the tribal communities because of what's going on with the Wampanoag tribe.
Thank you. There's a number of people are concerned about having voting by mail in September and November, and also saving the post office. We don't have too much time, but if you could comment on those issues.
I feel pretty good about those. Those bills were filed last week. I think there have been a lot of co-sponsors already. Again, on the House side, there's no lack of strong legislation that's been filed with support. Like I filed legislation, and with one email, I got 30 supporters on legislation for added unemployment insurance benefits for elders who had a COVID related pre-existing condition and stopped working earlier and would not be eligible. And I'm like a rank and file, files a piece of legislation. All these people sign on to it without much effort. 70 people signed on to my SNAP letter going to our congressional delegation, and they only had one business day to sign on. And that was allowing for EBT groceries. And so things like that are not even at all controversial, which is the case, at least in the House, for early voting and mail-in voting at this time. The problem isn't having legislation. The problem is making sure that we have that competence and execution to get the process moving. We're always really slow and lethargic around that. And we have all kinds of excuses for why that I don't agree with largely. But really putting on the pressure to say, figure out a way to get it done is where we're at now versus like, we need legislation that's gonna do this thing.
Thank you very much. The time we have allotted for questions is up. Cole or Brian, is there a way we can save these questions and get them answered after our meeting?
Yes, we can gather these questions, and to the extent Rep. Elugardo has time, we can ask her to answer them by email and circulate the responses. Rep.
Elugardo, can you do some of that?
Yeah, I'll get help. I don't know how many questions we're talking about.
Good. Yeah,
pretty flat out. But
I mean, you could pick the ones you seem most important or whatever. You know, you wouldn't have to do all of them.
What I would probably do is I would probably reach out to the Progressive Caucus and say, can everybody take a couple of these questions for me? and in this way, we'll get the answers back.
Yeah.
But yeah, we can definitely do that, especially if you stay on me about it. I'm just going to answer it quickly because I'm scanning through. With regards to undocumented people, and I'll also say people who are incarcerated, the courts have really helped us out on that. So there has been progress. Some people are being released, but there needs to be advocacy for specific individuals who qualify, whether it's for medical reasons or because they have a nonviolent crime in the case of incarcerated persons. And also for ICE, like the degree to which you can call on behalf of individuals. And so some of the advocacy organizations have given us lists and made that easier. And of course, constituents are calling. So that's where that stands.
Thank you. Was there anything else you wanted to comment on?
I'm just flipping through here. Unemployment insurance is a black box for us legislators, but the governor assures us that by April 30th, we're going to have a really smart plan for how the technology will have shifted to expedite and simplify the process with the expanded eligibility in there. Medicare for All, the attitude is warming up. And yes, I think people are focusing on, let's not say illegals, let's say, I'm just looking in the chat, let's say people who are undocumented. Yeah, we've got some legislation for that and there's strong support for it from what I can tell. Just trying to hit some highlights of what I see in the chat.
Yep. There's quite a range of issues there. Thank you so much. We are so happy that you are here with us and that you have brought us all this really important information about what is going on in the State House right now. So it sounds like any advocacy we can do is could help speed things up. So that's good for us to hear that.
Right. Well, yeah, I'm distracted by all these questions that are so interesting. But yes,
we'll save them. We'll save them.
Thank you, and thank you for all the work that you do.
Thanks. Okay, Brian.
Okay.